Time to roll.
Hello, I would like to welcome everyone to the September 24th Health and Ed Committee. And before we call the roll, I just wanted to thank you all for being here, for your continued dedication to Rutherford County. I think our absentee rate is 0. So you just need to be recognized for the dedication, because it's hard to get out on a rainy evening, and especially when the agenda is light. So thank you all.
Sir.
Commissioner Oliver,
Present.
Commissioner Davidson,
Here.
Commissioner Wilson,
Here.
Commissioner Boyd,
Here.
Commissioner McMurray,
I'm here.
Commissioner Gooch,
Present.
Chairman Dodd.
Here.
Thank y'all.
One acknowledgement, Commissioner McMurray, thank you for wearing MTSU colors. They look great. Good looking colors, and you wear it well.
I had on orange last night and I got railroaded for it, so thought I'd share the love tonight.
Well, I appreciate the love. We'll let Commissioner Reed know, right? Commissioner Wilson, have you read the minutes?
Yes, Chairman. I have reviewed the minutes of our last meeting. I find them to be in order, and without objection, I will move for their approval.
Second.
All in favor say aye. Aye. Motion carries. Thank you. Any public comments tonight, Carla? All right, we will move on to Director Cumbie and the Health Department monthly report.
Thank you. Thank you, Mr. Chairman and Commissioners. Your health department continues to do good work for the people of Rutherford, and we are proud to serve. Hopefully you have our August outreach report made available to you there on your iPads. And in keeping with our mission to protect, promote, and improve the health and well-being of all people in Tennessee, as we protect in that left column there with our disease intervention efforts, our immunizations, and environmental inspections. In the center column, we promote with our health outreach, diabetes outreach, and community participation. Vital records administration down there in the yellow. And on the right-hand column there, we improve with our primary care services, dental services, WIC, family planning. All programs are operational, on track to meet or surpass goals. In COVID-19, our COVID-19 rating is still low according to the CDC's hospital admission metric. Early indicators such as test positivity and emergency department visits have begun to go down. Hospitalizations have gone down as well. Deaths have remained even, and this is nationwide. But that does indicate that we are through the kind of summer bump that we would see there, and we look for a probable return in the around January for our winter kind of rise that we see. There is a new variant, as we frequently report to you here. The XEC variant is a new variant that is dominant in Europe. It has shown up elsewhere as well. It did originate as others, KP1 and 3 from the Omicron strain. So the prediction is that the new COVID vaccines are expected to perform well against this latest variant as well. So recommendations are for anyone 6 months or older to be vaccinated to prevent severe illness, those 65 or older or immune compromised in particular. If you were recently infected, like many of us were in the summer surge, you can wait 4 to 6 months from the time that you were infected to get a new vaccine. If you have not been recently infected or recently vaccinated, then October or November are optimal times to protect yourselves through those winter months. And the new COVID shots are now available widely in pharmacies and doctors' offices in our community and in our clinics by appointment. Monday through Friday, people can call 615-898-7880 and schedule an appointment for that. We can usually get you in within a couple of days for COVID vaccines. COVID test by mail, that is a program run by the federal government, and they are restarting that. And I checked the website today. It says it will resume by the end of September, so they've got about a week to get that going. And that website is covidtests.gov, covidtest with an S.gov. And each household can request up to 4 free COVID tests to be sent for them this winter. In flu news, the new fall flu shots have arrived at our health departments and are available. We do accept insurance for those shots, or for the uninsured, we charge on a sliding fee scale based on declared income. We do have the high-dose flu shot available this year that is recommended for 65 and older. I remember Commissioner Phillips asked us about that last year. It's not something they do every year, but we're glad to have that available this year. The CDC says that a flu vaccine that's well matched to circulating viruses can reduce the likelihood of becoming sick enough to require a doctor's visit by up to 60%. Flu shots are available as a walk-in service in our clinics from 8 to 10 or 1 to 3, Monday through Friday. In other updates, naloxone or Narcan is now available free of charge at our health departments and at all health departments in Tennessee. Anyone can go to the health department and request it. They'll be provided with an overdose reversal kit and instructions on how to use, and at no cost with no questions asked. It is very easy to administer. Overdose reversal kit sounds like there's a lot involved, but there's nothing to assemble or to measure. As some of you know, I can tell that it's given very much like a nasal spray. You administer it, you can wait 2 minutes. If nothing happens, you can administer another dose. By that time, EMS is probably on their way, and it really can save lives. So we want to spread the word that that is available to those who need it. In current events, on September 19th, this past Thursday, the Ascension St. Thomas Mobile Mammogram Unit visited our downtown Murfreesboro clinic here. We did 14 screenings provided to women that day. They received gift bags, and that gave us the opportunity to spread the word about annual breast exams, which are recommended annually for 40 and over, and then every 2 years for 55 and older. And other news, we are presently accepting donations for our second annual Coats for Kids campaign. If any individual or organization has new or lightly used winter coats that they would like to donate, please drop them by either health department location, Murfreesboro or Smyrna, from now through mid-October. This event was put together last year by our CHANT program. CHANT stands for Community Health and Navigators Access and Navigation in Tennessee. And those are our social workers there at the health department that help families with run through the complex, kind of confusing system of health care that we do have in the United States. We anticipate delivering those coats to children and families at our Fight Flu event on October 15th at our Murfreesboro location. And on that day, any parent, guardian, or child can pick up coats there at 100 West Burton Street. And that event, the coats event, runs from 12 to 4 on that day. On that day, October 15th, statewide, is the Tennessee Department of Health's Fight Flu event. And this year, on that day and after, flu shots will be free in our clinics. That day's event will include free flu shots at the Murfreesboro and Smyrna location from 8 a.m. to 4:30 p.m. And then we'll also be out at the Kittrell Public Health and Safety Building from 9 a.m. until 12 noon. That won't be a drive-through event this year. We will ask you to come in to get your flu shots, but we will accommodate anyone that is not ambulatory or needs accommodations. I did pass out another handout at our last meeting. I kind of flooded you with dates and events, and Commissioner Gooch suggested I bring a one sheet, so I brought that with me to present to you. And This highlights some of our upcoming events. In the blue are events that are hosted at our health department. In the gray are some of the events that our health educators will attend. And I wanted to take the opportunity to reintroduce them to you as well. It was probably 2 years ago the last time I spoke about our health educators and what they do. But they are really our bridge to the community. They are a fantastic resource for the community. Any organization, congregation, club, meeting group can request that they come out and speak on any topic dealing with health, and they will customize a presentation and come out and deliver to that in a very engaging way. These three individuals, they all have degrees in fields of public health or health education or exercise science or nutrition. So they are very careful in what they present and how they present it. They represent us very well in the community. And looking at some of these upcoming events, this flyer does have a QR code. That will take you right to a website where you can make that request to have them come out for your organization. So I appreciate you sharing that with your constituency, and we will keep these folks busy. And looking at some of these upcoming events, by example, the 19th was Ascension St. Thomas mammogram bus at our Murfreesboro location. Our health educators go to recovery court routinely and present there to the participants there. They talk about life skills, mental health, things of that nature. On October 1st, the Rutherford County Wellness Council meets at our health department, and our health educators always help facilitate that. The Wellness Council meets the first Tuesday of each month at 8:30 a.m. If any of you all are interested in attending, we'd love to have you there. This is a group of stakeholders from public service organizations, nonprofits, some medical clinics, FQHCs. They come out and just talk about the needs of healthcare in our community. They we manage our community health assessment through this group. Kind of determines the pathway and our priorities going forward at our health department. So very important. We meet monthly there at the health department. St. Clair is having a senior center expo on the 3rd from 8 a.m., 12 p.m., and they start at 8 a.m. sharp. There at the St. Clair Senior Center. The Day Reporting Center, that is where recently incarcerated people meet for accountability, and our health educators present to them as well. Doors of Hope, likewise, particularly women who have experienced incarceration, that helps them transition, and our health educators are present there. Then, of course, you have our flu event on the 15th and our Coats for Kids giveaway. MTSU pop-up event, we work a lot with MTSU, and we'd like to give a shout out to two of our MTSU nursing students that are in the building tonight. And then finally, the Rutherford County Council on Aging. That, again, is stakeholders involved in care for the aging, insurance, all manners of health care, and with a focus on the aging community, of which we all are part of. And they meet every other month on the third Thursday of the month. And so they'll be there on October 17th. And Mr. Chairman, that concludes our report.
Thank you, Mr. Covey. Very good.
Yes, sir.
Trey, I believe you have a comment.
Yes, thank you so much for putting this together. It looks really nice. I also would like to challenge Commissioner McMurray to attend the October 9th Healthy Eating event. I've seen some of the stuff he eats, and this is embarrassing.
That's why I don't look the way I do.
Touche.
On a more serious note,
Thank you. Oh, for bringing us back.
relative to your COVID vaccines, is there a fee associated with that?
There is a fee associated with the COVID vaccine. Of course, most insurances cover that. Anyone uninsured, we can't administer that on a sliding fee scale, and that's based on declared income. We won't ask you to provide documentation. You just tell us what your income is. We'll slide that and always make it affordable. And I like to say we never deny services to people who need it. And so even if we might ask you pay a minimal fee of $10 on day of service, if you retain a balance with us, that would never keep you from being seen again in the future, and that would never be turned over to collections.
Is that the same for your flu vaccines relative to insurance, or is it just this one day on the 15th where it's free?
Correct. What the state likes to do is they will charge a fee for the flu vaccine up until the 15th. From that day going forward, after that day, it will be free to the community.
Okay. Another question. Have you all brainstormed or thought about having a location in Laverne?
We have not. We would, we'd always welcome a conversation there if the community of Laverne, was interested in getting that conversation started. There's definitely a population demand there.
Absolutely.
Fortunately, for the north end of the county, we have people that serve the same population. We have a couple of FQHCs. We have the Primary Care and Hope Clinic, and then we also have the Matthew Walker Clinic there in Smyrna that help us carry that load. And so we are ever grateful for them, but we will take that under advisement. Yes, ma'am.
Okay, because I'd love to share some information about a new medical office building that was built on Murfreesboro Road that might be a possible location.
I see, okay.
Another question. With the mammogram clinic,
Yes, ma'am.
do you offer any type of follow-up for the women that you screen?
There are referrals made outward. Of course, this is a Ascension St. Thomas, so they do a lot of that in-house there. They will contact people about their results and then make recommendations going forward.
All right. Thank you so much.
Yes, ma'am.
Commissioner Oliver, to follow up, if, Director, your mission is primarily state funded, if you chose to expand, is there a process you're familiar with that could qualify you to have an office in Laverne or satellite? Or?
Not that I'm familiar with. Just speaking very generally, with the health departments, the kind of handshake agreement with the state of Tennessee is that if the county builds a facility, the state will help fund it and actually staff it. I shouldn't say fund it. The county owns the building. The county builds the building. So. What has happened in the past, we've had great organizations like the Christie Foundation here in Rutherford kind of step up and help us get things completed. And so, but obviously, we would be more than willing to facilitate that discussion and investigate it further.
Thanks, guys. I'll enter. Yes, Mr. Wilson.
Thank you, Chairman. Just a couple of comments. One, to kind of piggyback on that discussion there. You and I were having a discussion with the growth in North Rutherford and the size of the Smyrna facility. One thing I think we could take into consideration if we talk about future growth, we're looking at over 500,000 people in the county in 20 years, so the conversation's always relevant. I think we should look at what services are not available in Smyrna that are available in Murfreesboro. If we can have a more complete offering of services in North Rutherford, I don't know if that would require a facility in Laverne that offers the services we can't in Smyrna, but my mind says try to make the north end a bit more complete where no one from the north would have to travel to the Murfreesboro to help kind of control almost similar to what we've done with county clerk's office. We're trying to keep from individuals having to leave their area. So maybe that's something in the consideration as well would be what is it that we're missing in the north end that people have to travel to Murfreesboro for, and is it something we can either build onto, or if we had another facility, how do we make that work? That's just off the top of my head. The second comment I wanted to make was in our email boxes, I saw the wonderful social media flyers that you've given us all for the coat drive and also for the Fight Flu event. So as far as coats, you will take them, sounds like to me, up until the morning of October 15th, because you're going to distribute them that day. So
Exactly.
If organizations are collecting the coats, is it just to drop off at any time during operating hours of Murfreesboro?
That's right. Anytime from 8 to 4:30, Monday through Friday. We do have a process where we kind of go through the coats, make sure they're in good shape. We will sanitize or steam them if needed. Kind of prepare them for their new owner, new user.
Will you collect those in Smyrna as well, or does that need to be brought?
Some people do drop them off there. We do bring them to the Murfreesboro location for that event.
But if we had some Smyrna organizations or
Absolutely.
Laverne, they could drop it off at the Smyrna
Absolutely,
location.
yeah.
Okay, thank you.
Thank you.
Thanks, Phil. I'll entertain a motion. One more comment, Mr. Phillips.
Mr. Cummey, your budget, has it increased any over the last few years? Are you getting more money from the state to operate the health department?
There has been increases that keep up with new initiatives, but I wouldn't say substantial, but for example, this year they did allow us they're introducing a virtual interpreter service, so there's a line item for that, and they do increase as needed for insurances and so forth. You know, the state has their process where they look at the needs, and our Mid-Cumberland Regional Office was very supportive of us, and they do acknowledge that we as a larger department have demands that others don't, and they are always very equitable with what they give us.
That's a perfect response, but I'm just concerned about going forward as we continue to grow, our population continues to grow, that you're funded to the point where you can serve the people of Rutherford County as we go forward. And how would you communicate to us if you were concerned about that?
I would start here in this forum, and I would start with conversations with you all and let you know that we've identified a need that is not being met.
Thank you. You're on top of it?
Yes, sir.
Thank you.
Thank you.
All approved, say aye. Aye. Motion carries. Thank you, Director.
Thank you, Chairman.
Next on our agenda is Community Care of Rutherford County. The minutes of Community Care are published and they're on your SharePoint. I did notice one item in the minutes is the staffing is improving. It's apparently a raise has been granted to the nurses, and I know 3 people were hired this month, so that is good news. So consult those minutes if you have any questions. And we have Commissioner Phillips tonight following up on some questions we had a couple of months ago. Number one, the history of CCRC, and Jeff's taken a really deep dive in that. That's interesting. And also, I think we questioned 2 months ago, what committee should CCRC report to? We just had some questions about that. So Commissioner Phillips was courteously agreed to take that on. Jeff?
Let me apologize. I was unprepared last month, and I think I absolutely just forgot about it. So I've been kind of looking at this for this month's report, and it's really kind of interesting. If you've not been to the Rutherford County Historical Society website, it's really kind of a neat place to go. It goes back a long, long way, way back into the 1700s, and establishes a lot of information that we as Rutherford Countyans could find extremely interesting. Yes, very briefly, there's probably 20 pages of this, and I've just kind of highlighted a few of them. So let me kind of go through that as quickly as possible. The Tennessee General Assembly enacted legislation in 1826, that's almost 200 years ago, authorizing all Tennessee counties to levy a tax for the purchase of land and construction of housing for the county's poor and homeless. They required each county to appoint a committee. Rutherford County did that. Guess what they called it? The Poorhouse Commissioners. So the Poorhouse Commissioners were in charge of determining how the residents would be clothed and who among them, the poorhouse population, and this was also referred to sometimes as inmates for some reason or other, would work the poor farm and in what capacity. Back in some of those days, people were starving to death. That's the reason that the poorhouse was given that name. They would actually go to that, work on that farm, and actually earn their way. So it was called a poorhouse. Rutherford County appointed this poorhouse committee in 1828. So that's really when CCRC really started. In August of 1829, the committee recommended the purchase of a 100-acre farm situated on Cripple Creek. There are those that thought that Cripple Creek was named after the poorhouse or Cripple House, and that's not the case at all. It was intended from the outset that the resident poor would provide at least part of the operating funds working the poor farm and producing not only food for their own consumption, but some cash income as well. The original poorhouse and farm was sold due to a state of disrepair in 1867, and the county authorized purchase of 207-acre farm, and there were 8 houses that were constructed on that farm. So families began to work farms in the poorhouse. The poorhouse report at the end of the quarter, ending December in 1899, stated that that farm was in extremely poor condition, and at the end of 1892, the county purchased 200 acres along the railroad where our current CCR building stands. So we've owned, in essence, a poor farm since it looks like 1892. In 1905, and there's some questions whether it was 1901 or 1905, but by 1905, the county farm was a tax burden, it appears, to the citizens of Rutherford County, due in part to corruption and mismanagement. And along that road, community care began to emerge. Based upon the 1905 investigation by the Quarterly Court, which is us, the Quarterly Court, the poorhouse commissioners were all fired and replaced. The Mute Commission terminated the poorhouse superintendent, and in 1907 hired Raleigh S. Holden. Does that name sound familiar? Holden Hardware over here. It was their ancestors. The position was filled, and Holden provided excellent leadership because of his farming ability. The facility shortly after that became known not only as the Poor Farm, but also became known as the Pest House. That really struck my attention. What's a pest house? You know, it sounds like termites or something, but actually a pest house is something relating to people who have a terminal contagious disease. So people who were dying, had something like yellow fever, as an example, were sent to the poorhouse and mixed in with the other people. I don't know how that worked, but it seemed to work okay because the well people were taking care of the poor people, and it worked okay up until somewhere in the mid-1935 when Rutherford County decided to do away with the whole concept of the poor farm, the poorhouse, and established what was called an institution of living for the elderly. So in 1935, Rutherford County took over and not called it a poor farm, but created a place to care for our elderly. It seemed that it went okay up until the mid-1980s when it became once again a tax burden to the people of Rutherford County, and that's when the CCR board was established, and it became a private entity at that time, and the only responsibility that Rutherford County had was appointing board members and letting the board members manage the whole operation of CCR. So that's kind of where we are. In the mid-1980s up until right now, CCR has been managed by someone other than Rutherford County. And it's been financially stable ever since. I think the question was, what should we do? Why does CCR board report to Health and Ed versus like property management? I don't know that there's a real good answer. The CCR board has always reported to Health and Ed, and it's my belief that that's where it belongs. Property management is pretty much responsible for brick and mortar that type of thing, seeing those projects through, and even in some continuing management operations that don't require a lot of personnel. So I do believe that it belongs here. And let me just, some of the attorneys have wrote, you probably have read this, but let me just kind of read through it. CCR is a Tennessee nonprofit corporation. It is not a department of county government. CCR leases the facility from the county, and the lease between the county and CCR governs the relationship between these two entities. The CCR administrator is an employee of CCR and not the county. She is hired by the CCR Board of Directors, and she serves at the pleasure of the CCR Board of Directors. The scope of her employment duties do not include attending county commission meetings or committees, or otherwise reporting to the county commission or any committee thereof. The CCR administrator provides a monthly report to the CCR Board of Directors. This report is a public record and is provided to the Health and Education Committee on a monthly basis. In addition, one of the positions on the CCR Board of Directors is always held by a sitting county commissioner. The county commissioner is intended to be a liaison between the Health and Education Committee and CCR. I think that's where some of our disconnect has happened. Ms. Cook from the Laverne area was a member of that CCR board for well over 30 years and reported on, in essence, presented the minutes and reported on that board. Paul Johnson is now a member of that board, and it is my recommendation that when we appoint the committee structure next year, we consider making that CCR board member appointment a member of this committee so that they can report that. No changes this year since the committee structure is in place, but I would recommend that that committee member be a member of Health and Ed so that they can report that the minutes and any updates that's happening to CCR. So that's my recommendation. If you've not been out there, and some of us have on occasion, but if you've not been out there, it's a well-run, well-structured, and it has the support of many, many, many citizens of Rutherford County. If I'm ever in that position, that's where I want to go.
Mr. Chairman, my question was why? Because we have no obligation, no purview. So I'm wondering, why do they report to us? And I still didn't hear that.
I'm not sure there's a good answer for that other than this is a nonprofit organization and is not a department of the county. But to create a communication process, they're reporting to the county simply because the county appoints the board members. The county mayor is chairman of that board, and a commissioner is a member of that board. It's operated, in my mind, very similar to what the work board, the county work board is. The county mayor is chairman of that board, and the commission appoints those board members. And those board members, in essence, approve or disapprove some of the functions that are happening out at the workhouse, even the superintendent. So it operates similar to that. And that board reports to public safety. So it's very similar to that.
And it does, and they report. And so we don't get a report. We just get minutes. And so that's why I was asking about that for that particular reason, because if there was a question to come up, who would we ask since we don't have anybody to report like we do on public safety? Yeah. So that was my reasoning for asking the question.
And it's a legitimate question. The chairman and I were talking about that. It is a legitimate question, and I don't know that there's a good answer other than they don't even have to do that, okay? They don't have to do that, but we want that so that we can keep in touch with those people, and they volunteer to do it. Once again, a mayor and a commissioner is on that board. The mayor chairs that board, and I really think that we want to keep in touch with those people. When there's things that needs to be done out there, the building expanded or improved, property management becomes involved in it at that particular point in time and oversees the construction part of it. And we have no financial obligation other than to back that facility up. We may issue a bond, but we have no financial obligation to repay that bond. So we're still have a connection, but it's like a cosigner or something like that. It's an outside direction. I don't know that I have a real good answer for that.
That's why I was saying maybe they do need to report to property management, since that's the only purview we have is with the building. So that's why the question came about.
Yeah, it's in essence part of our health and well-being, welfare of the county, and I really think it belongs in where it's always been. I think it belongs here. And we can take a look at the minutes and ask questions if need be. You can also ask the administrator or the mayor to answer questions. It'd probably be a good for someone to come at least, every 6 months or a year, the beginning of the year, to give us an update.
And that was what I asked, and I was told, we don't have any responsibility to y'all. You know what I mean? So, that was my question.
Yeah.
But I appreciate that information, and I really enjoyed the historical coverage.
It's pretty cool, and I don't visit the history of Rutherford County enough, but this really kind of caught my attention, and all I did was read a few highlights. There's a lot of really cool things in there about the development of that house and how it came to be. So once again, 1828, 26, I believe it was when the state passed that legislation. And once again, I consider it the first time I've ever heard of a state unfunded mandate for a county.
Started early on. Trey?
And just to follow up too, Commissioner Oliver, it's never come up on who do we ask questions to and get information, because the mayor, serving as the chair of the board, would always attend our meetings, and then we would have the liaison, Commissioner Cook, here to answer other, questions also. So who to ask questions to never came up. Obviously, the mayor doesn't attend our meetings, and the liaison has no interest in coming to our meetings. So I think you're right. We really need to have some kind of a rule or function where a member of this committee is the liaison serving on the board that represents the county commission.
And so that, I think, will be the positive outcome from your being inquisitive. And Jeff's recommendation is wait a year. If this committee had other suggestions, if we could move somebody around, I don't necessarily support that, but that was just a recommendation of Jeff. We have a board member who's dedicated to the board and dedicated to his committees, so we can wait the year. Or
does that board, does he have a term, or is it every year we're reappointing?
you recall, Jeff, how the board members, what their terms are?
I think it's an every year thing, just exactly like our committee structure is. I'm thinking that's what it is.
And I didn't know if we needed to do that. Would we need to amend the private act or whatever sets this up? Maybe steering can look into that.
We'll ask Nick, okay. and then he can ask, or he can follow up with the steering committee. I think all we have to do is do it. As chairman, sometimes the chairman gets to make decisions, and if this is a chairman decision, that's what it'll be, okay?
Let's take it to steering. Let's let that be an action step for us tonight is take it to steering and see if what is the time frame. Their appointments may be off month from our year, so it could be within a few months they're reappointing their board. So let's, Jeff, do you mind let steering
I'll be happy
acknowledge
to.
us?
I'll be happy to. I'll bring it up at the next month's meeting.
Right, thank you. Ma'am? I don't think so. Yeah, I'm comfortable as is. Well,
just put it in the minutes that I'll do it, okay?
Thanks, Jeff. Next item, Dr. Sullivan, the school board. Had a pretty light agenda, but Dr. Sullivan, please come up. Wanted to just come and say hello and make sure we've got updates. So thank you, Jimmy.
Thank you, Commissioners. And my foot was asleep, so sorry it took me a minute to get up here. That was almost a stumble. Couple things just to give you updates. School board wise, we don't have any budget amendments this time. I do envision several in the next couple months. One, and of course our board hasn't voted. We haven't given them a recommendation yet, but just something I envision. We have over $100 million in fund balance. We put quite a bit of money back into fund balance last year. We stripped our budget pretty much for this year to bare bones, removed laptops for middle school that are part of our one-to-one initiative just so that we could hit our number. So we may have fund balance for school computers, possibly with radios. We've talked with Chris Clark quite a bit, and I met with the sheriff and his team last week to make sure that our radios are up to par for what we need in our schools. And another one is, and I'll go over this a little bit in enrollment, is we are continuing to see a huge influx of English as a second language students. That is the largest growth that we have in the county is still with our students who are English as a second language, which we are, of course, happy to serve, but that does require extra resources. For example, last year in our budget, we added 25 growth positions for ESL. We need 19 more as of today just to keep up with the growth. It is 1 to 35 state ratio, and it's just continuing to grow. I'll go into that. Let me hit enrollment then, if that's okay, since I hit on. Okay. Enrollment as of today is 52,033. So 52,033 students. That does include Springs Empower Academy. They have 182 students. They use our student information system, so I can pull their numbers very easily. American Classical is a little under 250. That does not include them. So with our two Rutherford County authorized charter schools, we're just above 52,250. We have received 104 students that have enrolled from Rutherford Collegiate over the last 2 months. And so some of those were our students, some of them were not. And so we had hoped that would, and it has helped us a little bit at Blackman Elementary with positions, but it has not helped us in some other areas because we've actually gained students from there that were previously either homeschooled or in the city school. ESL was the number I wanted to talk a little bit about. As of today, the number of English learners we have is 8,220. So 8,220, these are students who are receiving services. They are learners or what we call Tier 1 or Tier 2, so they've tested out in the last 2 years. 8,220 of our 52,000 students are English learners. English language learners, so English is a second language. We refer to, when you hear me talk about those terms, English learners or ELs are our students. That's what we call them. The program that they are in or English as a second language. For comparison, in May of 2023, May of 2023, we were at 6,214. And today we're at 8,220. May of 2023, yes ma'am, we're at it's in May of 2023, we were at 6,214. We had a huge increase from May to September last year. We went to 6,912. And then we, as of today, have 8,220. So we had about a 700 student increase from May to August of 2023, and then another 1,300 student increase from September of last year to this year. So it is very large, very large. So that gets us, I mentioned that we have 25 growth positions last year that we filled for English as a second language. We need 19 additional. So depending on how that works out in the next couple months, that will all be funded through some of our growth funds that will be able to fund those positions. But what is you've heard us talk about it, is that when students enroll with us, we're not funded for them until the next year. And so all of these students will be funded from, we do not budget what we call our outcome funding, how many kids scored so high on TCAP, how many kids were in third grade. It's about an additional $4 million. We do not budget that as revenue so that we can come back in January and cover what we know is going to be here for growth. So that's enrollment, and then I'll get to additions and everything unless anybody has questions about enrollment.
Bill?
Just to be clear, because I just think this is something that needs to be discussed in the public, May 2023, we're talking about 2,000 additional students. What percentage of the total growth is that the new students we received are requiring these services?
I'll go back and run that for the next time.
It's close to, that sounds like close to 100%.
It is. You just have students, of course, we have people that leave during that time. And so when we have students who are leaving, whether they're transferring to other school systems, those students are not requiring English as a second language services, and the students that are coming in are.
I know that you do a really good job of budgeting conservatively, and I appreciate that. We all do. The 19 positions we're looking at, if we're looking at an average growth number turning towards 80+% of incoming students or ESL, is 19 just to break even now? And do we need to keep thinking that we're going to have to look forward to needing even more over a year from now? Because you don't just find these teachers that can do this. So is 19 enough? We don't want to get in a situation to where we are not able to teach kids because we can't fill the positions. What are your thoughts on that?
So we actually decreased about 1,000 students this year in English as a second language from May to August, but it's not accurate because we tested that many students out. So we did well testing, and then new students came in. I know our ESL department asked for 40 last year, and I told her there's absolutely no way you're going to have 40 English. That's more positions than I would use to open a brand new school. There's absolutely no way. And Ms. Turnbow, unfortunately, was spot on right in her request. So I hate that she was right from a financial aspect of it, but I think you're onto something. We will hit our requirement as long as we have these positions by January.
I think
Question.
there's 235 ESLs then with that many students. There's 235 at a 35 student ratio. So that's a huge number. Commissioner, did you have your hand up first? And then we'll come to, go ahead, Hope.
2 questions. Are there any incentives in place to attract teachers to fill these positions? And if so, what are they?
They're $3,500 for English as a second language. We actually, I hate to say it, but we're under 20 open positions for the whole district, and most of them are special education. We have not had a hard time filling English as a second language.
Okay, and my next question was, what languages?
Largely Arabic. Arabic, yes, ma'am. Especially some of our biggest growing areas, yes, it is Laverne, but probably our largest ESL growth area of the county is Stewart's Creek.
And that's Arabic
It's
language?
Arabic, yes. That
Thank
part of the county is not what people think enrollment would look like at Stewart's Creek.
Wait, Trey.
Hearing in the news and everything that the administration is flying in migrants and dumping them off in communities to deal with, is that what is happening here? And if so, is the federal government reimbursing us anything?
To some degree, yes. We do not ask for, and we're not actually allowed to ask for immigration status or any of that type of thing, but I'm sure that is part of it, yes.
Excuse me. What was your question? I don't think your mic was on. I couldn't hear you.
The question was, it's my understanding, hearing in the news, that the administration is flying in migrants and dumping them off in communities to deal with. Was that the case here, and was the federal government helping to reimburse that? And I think you said that we don't ask.
We don't ask.
Certainly the federal government's not reimbursing us on that.
Correct. We actually got less federal funding this year than we have in the past.
I have a quick question. I just want to get clarification. So when those students return from the charter school back to you all, you don't get that money back, correct?
Depending on how many actual enrollment periods have gone back, Michael just won't send them a check for those students.
Okay.
Because we send it on the 20th or 15th of every month. I don't remember which actual time period it is.
Okay, thank you.
All right, then
As a
next-
follow-up,
Yeah.
relative to that question, considering the funds that go directly to the schools, do you get any of that back? Because I know you say you do a disbursement, but then there are funds that go to the charter schools, correct?
Correct.
And if those students are returning to the county system, are you getting any of those funds
We
back?
would not, no.
Will they reconcile at the end? Is there any period where there's a level set?
We will do a level set in October and also in March, but I think the part that you also have to keep in mind is that was done on this year's budget. And so to where we may level set, we still will not receive additional funding from the State Department for those students until next year. That's been the hang up. It's not anti-charter school, it's that we have to fund them up front. And then yes, next year they will send money for those students, but every year that we either at a grade level or a charter school, we are funding that up front. All right, that gets us to construction and kind of, I guess, some good news. The Laverne High School addition. The county commission approved the design fees last winter out of 189. Those bids are due to come in Thursday at 2 o'clock. So if you just want a riveting conversation, and if you've never seen how bids are opened and sealed bids and everybody sits around a room and fills out spreadsheets with handwriting, it is a riveting experience at 2 o'clock on a Thursday. We have Poplar Hill Elementary School, which was the Beatty Property Elementary School. That construction is moving along. I was out there today. They are scheduled to open in August of 25. We will hire a principal later this winter. That was all budgeted. Smyrna High School, we will have an official ribbon cutting after fall break, and so it is well ahead of schedule. Oakland High School and Riverdale High School are on schedule for next year, so it's still on schedule. Beatty Middle School, the county commission approved us using fund balance for the design fees two Thursdays ago, or whenever that meeting was, and that went out for design last Friday. We hope to have bids back for that and the whole design process done in March, so asking for county commission approval in April. So Laverne High School, if bids come in Thursday, as long as we have bids, which I envision us having bids, that will be asking for county commission approval in November. The middle school would be asking for county commission approval in April. We still are working through a contract, or a hopeful contract, for land beside Stewart's Creek High School for an additional high school on the north end, and that would hopefully be next month. We would look to come for design next summer sometime. But it's still, even if we purchased it tomorrow, it would be 3 years out before we opened. And that's kind of where we are.
Where did you say the land that you're looking at is?
Diagonal from Stewart's Creek High School. So it would basically, the way that we've looked at preliminary zoning is Stewart's Creek High School south would cover that area, and Stewart's Creek High School all the way up I-24 and even over in to Laverne would be this new school. So it would be a haul. But that is, trying to find that big of a package of land is where we're looking for. And that would envision, it's a whole different scenario, people that could see Stewart's Creek High School not going to Stewart's Creek High School. So, yep. You're absolutely right. You're not going to be able to school there. Yep. Selfishly, like from a naming standpoint, of course, the board sets a naming committee. It's off Rocky Fork Road. We have a Rocky Fork Elementary and Middle. I don't know if that's what they would look at. I have no clue what that project would look like, name-wise. That's all I've got, Commissioners.
Thank you. Mr. Wilson?
Thank you, Chairman. I've had a couple of conversations with Dr. Sullivan, and something I have been working on, and several commissioners and forums have heard me talk about this, but I'm wanting to get this in place by the end of the year. And that is, I've been talking to Dr. Sullivan about one of the issues I have seen in discussing the future of not only where schools should be located, but the urgency. One of the biggest, I think, conversations we have is how urgent is the ask that is coming to us? Is this something that if we don't do it, will it trigger a massive rezoning in schools? I'm just giving a rough example of why it's not just a 5-year plan. I think additional information for county commissioners who are tasked with funding these projects, in addition to the Board of Education elected officials that have to come up with how they're planning, I think the sense of urgency is something that has been lacking with all of us to have clarity to make better choices. So one of the things I talked to Dr. Sullivan about was I had spoken to Laverne and Smyrna's Planning Commission directors, and I talked to Kevin Rigsby and Smyrna to ask him, what would this look like? If we could provide a report that's coming from Laverne and Smyrna, from the north end, because that's where we're looking at the high school and the future. And by the way, at this point, the way growth is coming in Laverne and Smyrna, Rock Springs Elementary and Rock Springs Middle will soon be a problem.
They're past a problem.
It's the same issue. You're going to be able to throw a rock at either one but not go to school there because there will be so much growth in the north end of the county before you get to Rock Springs Road from Laverne. Those schools will be completely filled. And in those conversations, I've been asking about real tangible information. What is something someone can grasp? Hey, within 3 years, Arbor Ridge is going to be built with homes sold in 2 years, 3 years, whatever the time frame is. Expect that this is the timeline that looks like 450 units will be sold of mixed use, which means we could have 600 students, 700 students. If you knew that sense of urgency based on the Planning Commission's, just what their idea is, hey, we look like this project, the way permitting is going and communications, it's always going to be in development. It's always going to be not a guess, but just trying to forecast how projects will complete. But if you knew that by 2027, we're going to have 700 students in the north end, north of Rock Springs Elementary and Middle, I'm giving an example, we have a fire that we need to put out 3 years before that a lot of us may not even know how urgent that is. I feel like a report given possibly quarterly coming from the planning commissions on here's what we've approved. And if these projects develop out, this is the current time frame. We expect in this area 250 homes. We expect in this area 300 townhomes. If you knew that by a certain time period that you can expect this many students, I think that makes it easier and more simple for people not in real estate, but for county commissioners and Board of Education elected officials to really have a sense of urgency. And Chairman, I'd love your thoughts because we're in the same line of work on that. I'm thinking about something from them, and I asked Dr. Sullivan, what would be something that would help you discuss in those meetings, since the 5-year plan comes from the Board of Education, what would help those individuals make better choices, the best choices, and even switching gears when all of a sudden a 5-year plan, by the time you get 5 years out, well, the north end has grown tremendously faster than we thought it would. We're going to have to switch gears. So I'd ask Dr. Sullivan to start thinking about, and maybe that's a discussion with your board, is what could we ask for that helps you make decisions? And I want to help get that in place. And I feel like we're going to have cooperation from Laverne and Smyrna for sure to help produce this. Because it helps, remember, the municipalities are not in charge of funding education. The cities aren't. We are. So we've got to link up our communications with their planning commissions that are approving projects are not doing that with the responsibility of funding education. So if we don't find a way to work better together, we're going to end up, honestly, worse off than we are, I believe, now. So I just wanted to pass it on to everyone. I intend to get this in place by the end of the year. And this is something where input from any commissioners, the Board of Education, anyone that says, these are the kind of numbers, this is the type of information that will help me make a better choice on sense of urgency, I would love to hear that.
One thing when we talked the other day I didn't think about was that is part of what, and I can share his information. We used a third-party vendor last year, RSP, that got all of the building permits and the growth maps and all of those. I met with him today, and he was meeting with the city of Smyrna and Murfreesboro today. Laverne was not available, but he was meeting with them, so maybe collaboration between all of them would be able to help. So, good points.
I know I've been under the impression my years engaged on this commission that the school board has, to some extent, perhaps not as diligently or as predictably as you've are asking us to do. It's a great idea. They have, I think Trey and prior to him, Gary Clardy has tried to feed that 5-year plan with the Planning Commission anticipated growths. But I think our numbers are so high and the growth is quick. We are currently, there's some communication with the city. I know Darren Gore has asked for ways to put out more consistent information to the county. So the city's thinking that way. Mary Esther Reed reached out recently with the Poplar Grove School. Brian Hercules, the former town manager, reached out because the schools were coming online and they weren't coordinated with as distinctly. So you happen to be on the same path that Smyrna leaders, Jason Cole and Laverne leaders, and Murfreesboro are going down. So I think we're going to make some progress there. The information's available. We just don't know that we're coalescing it correctly. So it's a great idea. And having said that, we mentioned the location of the high school. Even if Jimmy predicts precisely based on all the actual data, and there's no land available except next to Stewart Creek High School, he's scrambling to make that work. So there's just another dilemma of how do we bring land online. Go ahead.
I would love to build a high school right beside Rock Springs Elementary Middle School. That's where it really needs to be, or where we originally thought that there would be property at that Laverne Lake Middle School, but that's just not where, there's just not enough land there for a high school. So that would be the perfect spot. It's just not there. So we got to put a school where we can get land.
But I'm hearing you ask for a specific plan of action from the school board or from this committee to how can these entities generate information on a consistent, predictable method, and perhaps we talk offline and engage via email with a few of the planning directors and start an avenue. It's a great idea.
Absolutely. What I'd like to do, if it's okay with the committee, is single point of contact with those planning directors will make it more streamlined. I would volunteer to do that since I'm the one that really kind of put my nose into saying, I want to help provide these numbers. I see the importance of it, both from a development real estate side and helping those that don't see how fast something can develop. You know, it can be in the plans and you see it for 2 years sitting there as a farm, but it's been sold. And all of a sudden, one day you come by and the trees are all gone overnight. And the next thing you know, you've got homes going in within a year. Well, at that point, with 3 years to try to fund and build something at top speed, we can be really behind. And now the way Rutherford County is growing, we're talking hundreds of students when that hits. And it will result, without a physical location, in another terrible rezoning on top of the one that actually hasn't even taken place yet. It begins in 2025. And you're talking about the possibility of triggering a possible bigger one if we don't have some of these solutions made. Since we see that coming, I want to try to get out front as much as possible. And if we need to get public support in, we're going to have to build some schools to avoid a situation where you could live 10 miles from a school and have to go another direction. We just need to get in front of it because we see it coming. So any input from everyone, I would like to, by the beginning of the year, be able to produce this report to help us make the best decisions. So any input from anyone, please send that to me, and I'm happy to report to those guys on our behalf. And we'll continue tweaking it. We're just trying to communicate better with information that's easy to digest and easy to understand. If I know when kids are coming, that means more to me if I don't understand development. If I know how many students are coming by a certain time that I need a school for, that helps make easier choices for folks.
Good point.
I'll just add, I don't envision our 5-year plan changing outside of adding this next year. We had it set based on our projections, and so the only new thing on our 5-year plan will be last year's gone, we have a new year. So.
But that could put some substance to the plan.
Yep.
Yes.
Anything else? Thank you.
Thank you. I don't know that that needs a motion either. No dollars. So, thank you for that information. Business before this board. We're adjourned.